Do you know of any public health professional who is looking for their first or next job? My guest on this episode is an expert in helping public health professionals get hired. She joins me today to share some guidance and insights. You're listening to the PHEC podcast, episode 405. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Did you know that we've launched an app for this podcast? Well, when we celebrated the 400th episode milestone, I knew it was time for something new and different, and we made the decision to invest in creating what so many of you have asked for, a special community without the distractions of social media or ads. The PHEC podcast community is an interactive digital space where public health professionals can connect, collaborate, rest and relax, and grow beyond the weekly podcast episodes. So in this space, you'll join a global network of public health practitioners sharing insights, resources, and opportunities in a focused, safe, and healthy environment free of social media distractions. Experience deeper conversations, direct access to industry leaders, and meaningful professional relationships that elevate your public health journey. The best part about this is, well, there's so many good parts about this, but it's available. This community is available on desktop, but also the app. We have an app for this podcast. So you can visit phecpodcastcommunity.com to join. You can also download the app in Apple or Google Play Store. And the links will be provided in the description of this episode, as well as on the show notes page. So I'm excited to interact with you in that new community, so make sure you download the app. I am excited to introduce you to our guest on this episode for so many reasons. First of all, she has been a guest on the podcast before, almost 4 years ago, back in episode 220. So much has happened since then. And as always, life happens and our industry develops and we grow as professionals. But in the last 4 years, she's experienced tremendous growth. And it's always fun for me to bring back previous guests onto the podcast for updates and to learn more about what they're doing and where they are. This particular guest, she and I have been connected, well, over 4 years now. So I knew her for a little bit on social media. And then I brought her to the podcast and we continue to engage on social media because she lives on the West Coast and I live on the East Coast of the United States. So we're very far apart. But we had the opportunity to meet in person. It was fantastic. I was working in California for a period of time and I had a day that was a little bit of a blocked out time. She lives in Los Angeles area. I was in San Diego and she drove down to meet me for lunch. And it was so much fun to, whenever you get to meet someone in person that you've engaged with in a virtual space, it's so magical. I know a lot of you can relate to what I'm describing. So we had lunch and we took some fun photos that I'll share on the show notes page as well. But it was really great to have that connection with her and to build that relationship, move it from the virtual space to in-person space. So I really like her as a person and a colleague. And then another reason that I'm excited about her being on this podcast episode is that she has been a valuable resource for public health professionals seeking new jobs and career advancement for several years now. Now, with everything that is going on in our industry right now. So at the time of this recording, we're in the spring. It's, well, at the recording time, I'm not sure when this will actually release, shortly after, because I tried to move it up in our lineup. So I'm recording this in April of 2025. We are experiencing just tremendous change and shift, unbelievable in our industry. So many people have lost their jobs, are being laid off, and everyone else is just stressed and wondering. So if you still have a job, you're stressed about what's happening. And I really began to think about what I could do to try to help in this situation. Everyone's really thinking that way because that's how we're geared. Every public health professional is really caring about everyone else. So I'm thinking about our industry and really thinking about how I can help. So I thought this was like the perfect time to bring her back. I felt like she's always been a great resource for getting jobs in the industry for public health professionals. But I felt like this is a perfect time to bring her back to the podcast for a fresh conversation and give her the opportunity to share some tips and insights that might be helpful right now. So let me formally introduce her to you, and then I'll connect our conversation. Zoila Reyna graduated in 2012 with a master's in public health from University of California, UC Davis, and holds a bachelor's in psychology from UCLA. She has over 16 years of experience in public health within state government, nonprofits, healthcare, and research. She has implemented and managed complex initiatives for tobacco control, chronic disease management, youth development, workforce trainings, substance use, and healthcare insurance enrollment. At the height of the COVID pandemic, she founded Public Health Hired and has successfully mentored over 300 colleagues across the nation on how to get jobs and internships in public health at reputable companies, all with no connections and no recruiters involved. Most recently, she quit her job at Kaiser Permanente as a senior consultant for community health to embrace full-time mentoring for the public health hired community. She lives in Los Angeles with her 2-year-old daughter, her 5-year-old son, and her spouse, as well as her German Shepherd named Delulu. I'm so excited for you to hear this conversation. So let me connect our conversation right now. Hi, Zoila. Welcome back to the podcast. How are you doing?
Hi, Dr. Huntley. I'm great. Happy Friday.
Yes, happy Friday. We're recording this Friday afternoon, both feeling the spring fever.
Yes.
And, we chatted for a little while before hitting record, just kind of catching up. But it is so nice to see you again and to have you back on the podcast.
Likewise. Thank you for inviting me. Honestly, I know it's been, I think, over a year since the last one.
It may have been a couple of years because I'm trying to figure out exactly where it fell in the lineup of the onset of COVID, if it was before that or during. I think it was maybe during that time. But by the time this episode comes out, we will have all of those details because we'll do a little fact checking and go back to that initial episode and make sure to connect the episode. I always really, I've enjoyed this series where I bring back some guests who've been on the podcast before to kind of catch up with where they are now. So we'll make sure to get the actual episode number and connect them so people can hear that one as well. This is just a really good time it's always a good time to bring you onto the podcast, but just with all the shifts in where we are now, this is the spring of 2025 with a new presidential shift here in the U.S. and all the chaos that has kind of been a part of that, with people suddenly losing their jobs and that have been in those roles for their whole careers. And now they're trying to figure out what to do. So we'll dive into some of that in a moment. But before we get into all of that, why don't you officially introduce yourself to our audience in case they are unfamiliar?
Wonderful. Yes. Hi, everyone. My name is Zoila Reyna. I am founder of Public Health Hired. We are in our 5th year of Public Health Hired. I like to remind folks that I am a public health professional. I am not a career advisor. I am not an HR person. I am not a recruiter. I am a public health professional, just like you, Dr. Huntley. I actually was at Kaiser Permanente recently for 7 years, a senior consultant in strategic planning for community health and learning. I loved my work in Southern California, but due to just the demand of public health professionals and students just needing help in navigating everything with getting a job, it was basically time for me to quit my full-time job at Kaiser. And so as of September of 2024, I'm happy to announce to the community that I am full-time your public health career coach. So my sole purpose is getting you a job. And I love that. I love to be in that space. And needless to say, I did not anticipate the wave and the chaos that has ensued with the Trump administration changes and everything trickling down. So I feel like I'm saying all of this because as I'm slowly walking through these changes with all of you, I'm realizing, oh my gosh, I've been training for this. This is it. This is what public health hired is for, is to really serve the workforce regardless of extraneous circumstances, regardless of where they sit in the nation. So I am ready for what's to come, and I am definitely hearing it from everyone. I don't want to get too much into the details. I know we're going to talk about that in a bit. But I am genuinely here for the community and holding on and learning just like everyone else. But yes, I am a public health professional. So thank you for having me, Dr. Huntley.
Well, I am really happy that you're here, and I thought of you and invited you back. Like I said, intentionally, I was planning to do this anyway to kind of recap as a part of the series of bringing back previous guests, but I just kind of bumped you up in our lineup because I really wanted to be able to present you as a resource to our audience as well. So I like to ask these questions for the audience members who are getting to know you, but also as just, it's very interesting to hear about the journey of how someone gets into public health and into the work that they're doing. So one of my favorite questions to ask, and kind of my next one for you, is when did you first hear about or learn about public health or really consider it as a career?
Great question. So I think I fell in love with public health in a very similar way that others fall in love with it, is you just kind of run into it. You didn't know it was an option. I didn't know it was an option when I was going to UCLA. I got my bachelor's in psychology from UCLA, but I was also pre-med. A lot of our public health colleagues were pre-med as well. And yet I had not really heard of public health. And then it was only when I started to work for a nonprofit, because with my bachelor's, I didn't want to be a counselor, but I also didn't know exactly what to do. I just wanted to do good for the community. And so I felt like nonprofits was kind of like the safest way to go about that. And I literally didn't care what nonprofit. I was just willing to work with any issue, any social cause. And lo and behold, the American Lung Association posted a job on Craigslist for this really cool job working with the FDA and helping with just compliance for tobacco sales. So I ended up falling into tobacco control and prevention right after my undergraduate degree. And it was because my outreach was focused on working with the public health departments. And it was my boss who kept saying, call the local public health department, call the local. And in California, there's 61 local county agencies. 3 of them are cities. Most of them are counties. And my portfolio was to recruit for 48 counties. So there was a period of time that I actually knew all the counties in California. I still do, but I was basically forced to work with local agencies, and I sat in their meetings. I started to ask them, what do you guys do in public health? And 3 years later, I went back and got my master's in public health at UC Davis. And full circle moment, I will be presenting to the group in person next week at UC Davis. The public health school finally invited me to be on their career panel with the state health representative. So that's how I ran into public health.
What a great story. And I love that kind of full circle moment like you described when you get a chance to come and give, give back and share. Career panels are kind of a fun thing for me. I like having those discussions and I love the questions that come. So yeah, this is really great. So tell me when you started Public Health Hired, because it sounds like it's a really interesting career path in doing that recruitment.
Yeah.
But at what point did you decide to start Public Health Hired?
So Public Health Hired was founded during the pandemic. And my intention with just sharing like what worked for me was really to help address the need for the workforce to get to work. And obviously with the pandemic, there was a call for case investigators and all of that. And so what ended up happening is I just decided, why not share what worked for me to get my Kaiser job? Because I remind folks that everything I teach you all with the Hired framework and through Public Health Hired is everything I've done. everything that I've done for my own career. And it shot me into a 6-figure job, making $150,000 at Kaiser Permanente with no connections. But I actually got to live and swim in my skill set and grow and be challenged. And I was really in it at Kaiser. But then when the pandemic hit, I felt, you know what? I'm just going to share what worked for me. Like, I wasn't even looking to make a dollar. I already had a job. I was working remotely all of a sudden. I had my son with me, and happy hours were gone. Lunches were gone. Coffee meetups were gone. Like, everyone was social distancing, right? So I couldn't see anyone. And it was also like a need for me just to interact with friends and colleagues. And so I thought, why not just start to share what worked for me? And so I did free webinars for a couple months on Eventbrite, just letting folks know, hey, anybody need to talk about getting a job in public health? And honestly, the Lord works in mysterious ways. I tell people that. And I didn't really name the company as much as it just sort of came to me. Like, when I started my Instagram page or when I started anything, I was like, what do I call this? Is it public health jobs? Like, what is it? And it was like a whisper at night that just said public health hired. It's like, oh my God, that's it. Oh my God. Yes, yes, yes. And mind you, I didn't have one person hired, but it was just something behind the name that I felt very comfortable of, like, yeah, that's what we do here. Like, we get hired here, period, said and done. And so from there was someone on Eventbrite who showed up who was a past intern of mine. Her name is Nancy. She is hired case number 1 and my first client, because she's the first to get hired, but also the first to give me money. So Nancy is the person who seeded the company with just wanting me to coach her through all of her process of what she was going through. But I feel like the Lord really put her in my path to be like, you need to see Zoila again. And when she saw me on Eventbrite, she was just literally throwing money at me. She was like, what do I do to work with you? Like, do you have services? What's going on? And so love that she found a job at the American Heart Association. So she got out of her position at the correctional facility. She was a health educator at the correctional facilities. But yeah, I feel like genuinely the purpose of Public Health Hired is to help the workforce, especially those who have no connections, those who are first generation, those who are just learning the ropes, recent graduates, people even looking for internships, and then even people who want to just pivot out of certain areas. My own story is that I was stuck. I like to say that I was stuck in tobacco control and prevention across 4 companies. So I tried to grow out of tobacco control and prevention, but every time I kept getting wrangled back by another company between the American Lung Association, the California Department of Public Health, then back again at the American Lung Association, then at Kedron Community Clinic for their tobacco cessation work. So I just couldn't get out of it. And it was only until Kaiser, their opportunity came up, that I seized it. And then I was able to have a portfolio of everything else besides tobacco control. So I'm also very passionate when I meet someone who's like, quote unquote, stuck, right? When they're like, I've been doing mental health for, 5 years. I've been doing maternal health and reproductive health, and I can't get out of this space. And so I also feel like that is what Public Health Hired is for, is to keep you moving and evolving and growing and just seeking that next thing, right? As far as how can I better help my community?
That's wonderful. Thank you for giving a really good background and introduction to yourself and your why, the organization, and kind of the mission and how Public Health Hired is showing up to support. A very comprehensive introduction. And every bit of it is important because you have the public health background yourself. You've worked in a variety of settings. And I remember from our last interview that there's this humbleness about you. Like, I'm sharing what worked for me in those early days. And now you're several years into this, you're still sharing what worked for you, but also you've got stories of how it's worked for clients that you've helped as well. So
it's helped over 300 people get hired across all sectors. I have a masterclass, a mentorship, and a lot of people actually get hired by just the free guide, the free tools, the free lessons, because they'll quickly realize, oh, I've been searching for jobs completely wrong. Oh, that's what this thing means, right? And the beauty of Public Health Hired is that it's not in a vacuum. None of this is in a vacuum. I think people are shocked to hear that it is a true community of practice where It's all of us. Everyone in this community, all of the members, all of the participants and followers are public health professionals or health related. I have a lot of medical professionals who are looking to do more administrative work, right? So if you are just wanting to give back to community and contribute and be in that health related space or social services, this is a safe haven for you. This is a safety net. This is a place where you will hear from others who are going through something similar, maybe in another state. So I love that I've been able to bring people together in an organized fashion where they can really pick where they want to learn and how much. And what I love even about my masterclass is that it's one-time fee. And so people just have it forever. Once you have it, you just have it. And so I'll have people tell me hey, I got a job with your masterclass 2 years ago and I'm doing it again. I have a couple questions. And so they're just picking it up and going and growing because the method of the hired framework holds true, not just for me, but just across everyone, which is why it is this true community of practice where I'm getting feedback from them. I'm getting feedback from people who are using the materials, using the lessons. They're the ones who ask for more. Can you explain that a little bit more? What do you mean by that? Can we have a guide for that? Can you do a visual of that? So I'm over here just sharing, but they're the ones who they're can you pause? Wait a minute. Hold on. You just said something there. Let's go deeper. And so anyone who comes to Public Health Hired will quickly realize, oh, wow, that resonates. Well, yeah, because I'm talking to everyone in public health every day, all the time. So I want people to know that this is a learning community. It is a community of practice. There is no judging that, oh, you've been doing it wrong. You should have been doing that's what. I'm just transparent. I'm very transparent on this is what works for me and this is what's been working for others. And now this is how you can use it for yourself.
I think that's great. I want to dive a little bit into, we both talked about the situation, the state of chaos is really how I describe it, that we're in here in the US with the changes with the Trump administration, how it's impacting public health. And I'm sure you experienced this. I've spent a lot of my time on LinkedIn, and it is impossible to scroll through my newsfeed without reading a devastating story and impact how these changes are impacting my colleagues and the programs, of course, and the community. But if we think about the colleagues and what that means to our profession, not only the people that are currently in positions that have been wiped away and given no notice and their jobs have been taken, but also our students who are invested in their Master's of Public Health program or their bachelor's program or their doctoral programs. And then they're like, oh, well, what does this mean for me? What are you seeing, or from your perspective, what are you hearing and seeing from people that are coming to you just in the last few months?
Oh my gosh. I have definitely been getting the DMs and the messages and just the notification that they were laid off or they're anticipating to get laid off. I did put a post on LinkedIn that folks are welcome to reach out, send me your resume. I'll just start pointing you towards some basic information just so that you get a little bit of hope, right? I mean, this is so traumatic. I do remind folks that while you may be all of a sudden unemployed, please take some time to take care of your mental health, emotional health. It's a lot to process that this is happening. And, it's not personal, right? But it's hard to take it not personal. So I'm finding myself not only being helping people point them to here are some job options for you, but also reminding them that it's okay to take time. It's okay to also decide who to share this with. You don't have to share it with everybody. So I think I'm also trying to help people kind of calm the panic and just also inviting them to come to, if they already have the masterclass, for example, and you haven't tapped in, just plug back in. So there are ways that folks can kind of reach out just initially on, hey, this is happening to me. What do you recommend? So if anyone's listening out there and you are unemployed, you're welcome to just DM me on LinkedIn or Instagram. But essentially what I'm hearing is people want to know, what do I do now? What does this mean? Are there going to be jobs for me? Do I need to abandon government altogether? Right? I think not some folks, but even I felt like getting to the federal level, that's the gold star. Oh my gosh, this is the dream, right? Because you're helping across the nation, your influence is there, you're part of such a, great team. And you also there's a little more permanency that we thought came with these jobs, right? People were willing to sacrifice maybe even a little lower pay than another company in, say, healthcare or philanthropy because of the permanency, because, oh, well, this is stable work. And given the decisions that President Trump has taken, that no longer is true. The incentive to be in federal government, right, for permanency, for security, for financial security, it's no longer there for our workforce, unfortunately. And I don't think that even he recognizes the impact that that has made across the nation. And I know this is happening across other industries, right? We're hearing with Department of Education, IRS, it is not just public health and health and human services. It's all industries are feeling just different ways that the president is making his decisions. But all of this to say that I think as much as the federal government has, been funding a lot of the work, what essentially has happened because of COVID, our workforce was being called to action, right? We were called to action. There was resources for us to get out there, do the outreach, do the education, do the interventions. And it continued. It has been continuing. In fact, at the conference, the SOPHE conference, Society of Public Health Education, just this week that I was at, I've met a handful of nurses or health educators who work for either local government or state government that were told, your funding that came from COVID to do this work for infection control is likely to end in June. And this nurse that I'm thinking of has been working for this one company since 2018. Even before COVID. And so she was just working through COVID. She still has PTSD from COVID. She's like, I can't talk about COVID. But she's like, now with this, you're just being cut off from your heels. What is this? And so I get it that for so long in these last 4 years, our workforce was in a positive light asked to be out there. We were needed. We were in demand. The competition was different because we all knew that, we're all needed, but there was no worry of, is this job going to still be around in a month? And now that's the opposite. So what's happening is it's not only affecting those who work for the federal government, but it's affecting those who receive the funding. It's affecting those companies that had DEI who are abandoning DEI, right? It's affecting them in different ways, and the trickle down is slowly happening. So I'm even thinking of a mentee from LA County who works for epidemiology and surveillance for HIV, and she's also been informed that that work will end in June. And she was also told it might end sooner. That is what's happening.
I've heard similar. I have a client, it's one of the state agencies, and that is what has been described. A lot of the funds, when there's excess from, say, COVID dollars, they were used to hire people and expand programs. So some of that funding, supported partial salaries or full salaries. And now those people who may be doing seemingly slightly different work that's funded by COVID is suddenly they're gone or their positions are removed. So in this context, this is extremely frustrating. I know a lot of what we're talking about, people are listening and living it, and it is part of the chaos that we're in. But I do want to leave our listeners with some actionable, steps. Now, I will make sure that connection, links to connect with you will be in the show notes page. So if you're listening and trying to figure out, how to find, don't worry, I will make sure that you have links to connect to Zoila and her resources at the end in the show notes, and I'll explain to you how to get to that. But if you're listening and maybe you just want to have something like, what can we do? Even if until they reach out to you or if they don't jump into your program, just what can our listeners do? Are there any tips that you have for people who are listening that are maybe in one of these scenarios?
Yes. Thank you for asking. I will say that I'm doing my best to pump out that kind of information, especially in our YouTube page, because these conversations of what do I do now are happening in my office hours, my Tuesdays office hours for my masterclass. This last Tuesday, I had 20 people attend, and it's slowly grown. I mean, I've had about 5 to 15 on average, but the fact that 20 are showing up at once to me is a sign of the times that they just all need to hear from each other and really get some advice. And so what I've been telling them is for the year of 2025, we're going to be following the money. Obviously, everyone's in different situations. Some of us have families. Some of us, can't I'm telling people, if you need a quick job, there's part-time jobs, there's temp agencies. Some people are wanting to start consulting. Okay. But do what you have to do to get some quick cash. Yes, even unemployment funds might be available to you if you're really in a bind, because sometimes we just need to pay our lights and our bills to kind of be able to think clearly. So I will tell folks, first and foremost, do your budget, make sure you know what you need, obviously spend less in places that you can. But as far as that full-time job, that next job, it will still take 4 to 8 months to get a job. So don't start to beat yourself up that you need one by next month, because you're already going to just beat yourself and burn yourself out. So I'm trying to help them be realistic on what to expect, even though this is the climate of the times. And the reason I'm confident that people will still be getting jobs between the 4 to 8 month window is because I'm pointing them to where the jobs are, where the money is. So while federal government may take 4 years to get their ish together, I am not going to waste our time on usajobs.gov. Instead, I am still pointing people towards the philanthropy groups that are funded by private donors, right? I'm pointing them to corporate social responsibility or social impact, that's funded by large companies that are for profit. I'm thinking CVS Health. I've been promoting Allstate Insurance lately because they've been pumping out community health initiatives for youth engagement and development. So I'm trying to point them to even associations that are funded by membership fees, where they're not even running on grants, right? A lot of your listeners and a lot of just the public health community assumes that most of the money is federal, or most of the money comes from that. But I'm someone who tries to demystify that and remind you all that there's money from taxes, right? From like tobacco taxes, other kinds of taxes that go back into prevention. There's also fines from restaurants and businesses that serve. And so they're fined for not, sanitation compliance or anything they're doing. There's also drug settlement money from pharmaceuticals, like the opioid crisis. So there are states that manage to those funds privately. So that is money that the government can't touch. And then there's other places, like I said, with healthcare, hospitals, and corporations doing more corporate social responsibility, more social impact. In fact, at Kaiser, I remind folks that I didn't work for Kaiser Permanente, the hospital. I worked for the Kaiser Hospital Foundation that really repurposed the tax savings to give back to the community. And that is part of the portfolio of work of pretty much all hospitals. So I remind folks that there is lots of money out there, and there's a lot of companies that do value community health. It's just not the way that you define it. And that's where the work is for those of you who are looking to pivot, you need to give yourself time to explore and check your understanding and open up your understanding to how maybe one company talks about maternal health, this way, but maybe another one will talk about it more about, prenatal and reproductive health, right? So there's just these nuances that you have to follow. Here's a good example. People are worried that DEI is going away. It's not. It's changing. It's evolving, because what I saw this last week and the week before, and I shared with my group on office hours, is that I'm seeing them change the definition to well-being and belonging and engagement. So I'm seeing not diversity, equity, inclusion anymore. I'm seeing well-being and belonging to take that space so that they're not at threat, or they're not, looked at as far as taking their funds away, or nobody wants to play nice with them anymore because nobody does DEI anymore. So that kind of thing. So I'm just letting folks know that this year in 2025, it's going to take an effort from our workforce to basically keep up with the terminology as it's evolving, because personally, I don't know if a certain philanthropy group or a certain association is going to completely redefine their work, but yet stay the same. Or are they going to keep it the same because they're not impacted and they don't really, they're not at odds with what's happening at the federal government. So it could be both. You could go both ways. And unfortunately, the onus is on the workforce to keep up with the employers on like, how are you guys redefining the work? Are you guys pausing? Are you guys repackaging it? What's happening? So I will say that as much as there's worry, I think the companies that really have their values together right? I don't want people to forget that we are in America and we as American citizens have significant values. That also means that the CEOs and, other people that make up the companies have the same values of like, no, we want to provide and care for our communities. It only benefits these companies, right, in their own way to have presence, to do outreach. A lot of this is marketing for some of them, but it's not called marketing, right? It's public health, it's outreach services, it's health education. And I did write some notes, Dr. Huntley, if I could share with your listeners that there are certain focus areas that are growing, right? So I know a lot of our listeners are, they want to find the jobs in maternal health or behavioral health or substance use prevention, right? And I get that. The way that I find jobs is through skill sets. So great, you can, we'll do a little bit of that, but then after you're done kind of searching for focus areas, I really help individuals realize, oh, I have a lot more to share around coordination, collaboration, stakeholder engagement, scaling best practices, and so on. But for those of you who want to know, okay, that's great, but still, what about the focus areas? Is maternal health gone? Like, what's going on? I have been watching the market and I am noticing certain areas that are still fully funded, whether it's through philanthropy groups, whether it's through local government, right? There's still a lot of jobs in local government and state government. Don't leave them out. But the focus areas that I'm seeing being hired for include employee health, military health and veteran health, social impact, corporate social responsibility, immunization, children's health, youth development, substance use, environmental health and sanitation. Misinformation and communication is still very much needed. This next one is one of my favorites, knowledge management. That learning for a community of practice, knowledge management. And then lastly, workforce development and trainings. That is still going on. So those are the areas that are still highly growing.
So helpful. Zoila, thank you so much for taking time. You shared so much with us on this episode, and I really heard the call for so much of it resonates with me. What really I feel will settle in with a lot of our listeners, especially if they're to kind of ease some of the anxiety and kind of minimize some of the panic. We really can't panic, but, do what you need to do right now. If you need to, assess your budget, your situation, do what you need to do because we have to pay the bills. We have to keep the lights on, put food on the table, right? If that's grabbing a part-time job or grabbing something on a temporary agency, kind of to unemployment, really just mentioning that if that's an option available to you, grab what you need to grab to kind of put a Band-Aid on things for right now. And then in the background, as you're looking for that next opportunity, which could take several months, really taking some ownership in being up to date on what's the terminology in the workplace and the workforce, where are the opportunities, because not absolutely everything has stopped and halted, and seeing where there's opportunities and, assessing your skill set. And so those are things that some people can do on their own if they don't have the resources to join your masterclass. But if that is an option for people, then I do highly recommend the masterclass. And like I said, we're going to share the resources that you offer, the opportunities to work with you. But you shared a lot right here for people that they can take away. And I appreciate that.
Well, thank you so much for your time. Honestly, I know you're busy and I knew we were going to record another session at one point this year. I just don't think we both anticipated to be like, okay, you're on.
I know.
So thank you for making the time.
Yes, this is really important. And I've been getting a lot of those types of questions also in my DMs on LinkedIn, and I've sent a few people your way, and I thought this is a really good time for us to have this conversation. So.
And genuinely, people are welcome to just, say hi. Like, I'm also just available if you want to connect on LinkedIn. No pressure. I'm here when people are ready. So awesome. Thank you, Dr. Huntley. Appreciate you.
Thank you so much. It's great to see you again, and we'll definitely be in touch.
We'll be in touch. Yeah. Thank you. Bye, everyone.
I really hope you enjoyed that conversation as much as we did. Zoila is a great resource for the public health industry, and I encourage you to connect with her and learn more about her programs, and also share this podcast with your network and community of people who might be looking for a resource like this. You can find the links to the previous episode with her back. I mentioned it's about 4 years ago. It's always nice to kind of follow the journey, as well as all of the links to connect with her on the show notes page. The show notes page for this episode, which is episode 405, can be found at phecpodcast.com. Once you're there, just navigate to episode 405 to find its show notes. One more thing before we go. Remember to download the new PHEC Podcast Community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.